JT is a 61-year-old man who has COPD, more specifically emphysema. Some characteristics of JT's COPD include a barrel-chested appearance and pursed lip breathing. An X-ray of his lungs show hyperinflation and a flattened diaphragm. His FEV1, or forced expiratory volume in 1 second, is 45%, which is categorized as severe according to GOLD. JT's symptoms include trouble breathing or dyspnea, active weight loss as he's lost 25 pounds since he was diagnosed 6 years ago. He also has edema in his ankles, formation of clear sputum, cough which is worse upon waking up, and a lengthened expiration with wheeze. He does not have any comorbidities accompanying his COPD, but does develop acute bronchitis on occasion that is treated outpatient. JT's risk factors have to do with him being a 2-pack-a-day smoker for 37 years, along with the fact that his father died of lung cancer and his mother has COPD. As for contraindications for exercise, JT has had a first metatarsal and left lateral malleolus fracture repair over a year ago, which should be taken into account considering he's 61 years old. He also had a mild stroke 4 months ago, which should be considered. Finally, when JT's symptoms seem to worsen, exercise should be limited until he gets better.
Taking into consideration the patient's current health and past history, light aerobic exercise would be highly recommended. ACSM guidelines suggest at least 20 minutes of walking daily for 3 days a week. Once JT's condition improves, he can begin adding resistance training and flexibility work into his routine. Higher intensities will have more physiological benefits, but care must be taken to reduce injuries. Falling down is a common occurrence for people with COPD. Because our patient is a 61-year-old male, it's important to maintain decent posture, limb strength, and retain as much FVC as possible to have a certain quality of life.
COPD is said to be the 4th leading cause of death in the world and will eventually reach number 3 in a few years. 75% of cases are attributed to smoking cigarettes. Over $14 billion in expenses alone in the US due to COPD, and by 2020 it is said to be the 5th among the conditions with the highest burden to society worldwide.
Mechanisms of disease and rehab. When smoking, eosinophil and fibroblast cells contribute to thickening the airway and increases the airways of smooth muscle. In addition, T cells and mast cells signal proteases enzymes which break down elastic tissue, as well as causing emphysema, flabby lung. Lastly, proteases also affect the goblet cells and produce more hypersecretion, also known as bronchitis. Chronic obstructive pulmonary disease is a lung disease that makes it hard to breathe. It often gets worse after time. COPD is characterized by inflammation and limitation of airflow in and out of the lungs.